You're on YouTube.
You're on YouTube now. Okay, I'm going to talk to you today about instilling PICC lines as a, hold on, start over. Okay, being patient advocates, we are constantly looking to better our patients' conditions. And one major issue with more of our ill patients or patients that are staying for an extended period of time is peripheral lines versus a PICC line. And PICC lines can be a great improvement to our patients' health if we try to impose that and educate them into getting a PICC line placed as opposed to changing a peripheral line every three days. Those patients with extended hospital stay, extended antibiotic therapy, long recovery from surgery or illness are having to have their peripheral line changed and are having to have labs drawn from different other sites, and so they're getting stuck multiple times. And so this can be a major problem and a nuisance to the patient. It also increases their potential for infection. As you can see here, compare the two, and peripheral lines are also very hard to get if a patient is dehydrated or very ill. A lot of times it's very difficult to find placement for a peripheral IV. Like I said, as research has done, Wikipedia and some of the other medical online sources have found that it's a greater risk for infection to have peripheral lines and to have them changed because it's not a sterile procedure. We try and clean as best as we can, but it's not done sterilely, so there are greater potentials, and they're usually in places where people are on their hands or arms where they can get removed or get bumped and have a chance of coming out or loosening, and then bacteria can get into the line and cause infection. Also, if you have a peripheral line, if a patient has a peripheral line and they needed extended IV therapy, they have to stay in the hospital for that entire time. They can't go home with a peripheral line. So this is another great inconvenience and could possibly lead to them getting more nosocomial infections from them just being in the hospital a longer period of time. And then also increases their costs too. So as nurses, we can educate our patients into getting a PICC line. And PICC line is a peripherally inserted central catheter, and it can stay in for weeks or even months. And it reduces damage to the small veins of the arm or the hands. And it can have multiple channels, so not only can a patient get fluids or nutrition, they can also get medications or even blood transfusion through the multiple channels. There's also a very significant decrease in the chance of infection as research is done by the New England Journal of Medicine. And the patients can also go home with a PICC line. They can be sent home for antibiotic therapy and continue that at home, and they don't have to stay in the hospital. So that is another great benefit that patients can have from having a PICC line placed as opposed to a peripheral line. So as nurses, we would like to go to our managers or administration and let them know as to how this would greatly increase the well-being of our patients and how they can benefit from having a PICC line as opposed to a peripheral line. For those who are staying 6 days or longer, or those who have extended antibiotic or IV therapy, it'd be a great benefit. And so in educating our patients, we would need to tell them how a PICC line would be placed. And a PICC line is placed by either a certified nurse or a doctor, and it's placed using sterile procedure, And usually on the upper arm, it's cleaned and a local anesthetic is used to deaden the area where the needle will be going in. And the needle is inserted through the skin into usually the brachial vein in the arm. And the needle is viewed on an ultrasound that the nurse has so they can see exactly where it's going in the vein. And a guide wire is used to advance the catheter into the upper tip of the heart. And once the catheter is in place, the guide wire is pulled out, and then the catheter is, the outer part of the catheter is sutured into the arm so it doesn't move, and then covered with tegaderm or some other covering so it can stay clean and sterile. And then the peripheral line or the PICC line is, the patient is sent to x-ray to get an x-ray done to make sure that the catheter is in the correct placement. So it's a very simple procedure. It only takes a few minutes, and it can decrease infection, and it is a lot easier to take care of and can stand for a longer amount of time. So as nurses there, we need to educate the patients for the benefits and our administration managers and try to push them towards using these or making it mandatory for therapeutic IV therapy or other such cases to use PICC lines instead of peripheral lines.